Dear parliamentarians, dear participants, thank you very much for this opportunity to address something that for the global health is extremely important and very urgent. There are many reasons why we need to accelerate our fight against air pollution. There are many reasons why we need to obtain good standards on air quality, but probably one of the most powerful will be the health argument. I think it's important to remind everyone again why we are putting in place all of those measures to fight air pollution. And one of the reasons is because every year, more than 43% of the deaths caused by chronic obstructive pulmonary diseases is linked to the bad quality of the air we breathe. 25% for heart diseases, 24% for stroke, and around the same figure for lung cancer. As you can imagine, health is really a very strong motivation to accelerate the transition to clean sources of energy, the ones that will not pollute, the ones that will protect us from the bad quality of the air we are breathing now, the toxic air we are breathing now. The air that is responsible every year globally of more than 7 million premature deaths. 7 million premature deaths caused by the fact that we are breathing air that is not respecting the minimum standards that will be protecting our health. That's why we congratulate very much and we appreciate the efforts of you parliamentarians on approving this new law on air quality. Although it's not exactly respecting or aligning with the recommendations of the WHO air quality guidelines, we are convinced that this will represent a very strong step in the sense of ensuring for our citizens better quality of the air we breathe and therefore protecting our health. But it's not just our health. By putting in place the measures we need to reduce air pollution, we are as well generating economic benefits. We are as well generating more equity in terms of the quality of the air we breathe. And of course, we are contributing as well to fight the causes of air pollution and climate change, because those causes overlap on a 75%, which is the combustion of fossil fuels. Whatever you do on those interventions you are putting in place to accelerate this transition to clean sources of energy, be aware that you are doing as well a very important agenda. You are contributing as well to a very important agenda on global health. You need to be aware that any intervention from a political point of view that you will be pushing for and endorsing the air quality guidelines of WHO, what you are doing is not just a change in the quality of the air we breathe, you are doing something amazing, which is protecting people's health, reducing mortality, reducing as well the bill that our hospitals are already paying. Clearly, the biggest price is paid by our lungs, by our health. But in addition to that, we can have extraordinary positive benefits if we combat the causes of climate change and air pollution, which are, as I mentioned, overlapping in many circumstances. The other enormous benefit is the fact that our society needs to breathe clean air. There is no reason why in 2025 we still need to justify why breathing clean air is necessary. We have more than 95% of the population around the world breathing air that is not respecting the standards promoted by the World Health Organization. Some people might say that those standards are very ambitious, but is there a high level of ambition when we are talking about the health of our people? It's never big enough, our ambition, where we are trying to protect people's health, reduce the chronic diseases caused by the exposure to this bad quality of the air we breathe. And that's why I would like to bring to you the congratulations on this law, but at the same time, for you to keep the sense of emergency, the sense of urgency. This is an urgent public health matter that will bring us enormous benefit, even economic. The bill that we are paying in our hospitals will be reduced. Let me finish now with some advertisement. The reason why I cannot be physically with you today is because I will be in Colombia in the preparation for the second global conference on air pollution and health that we are organizing, and we count on your very strong support. This conference will be 25 to 27 March in Cartagena de Indias in Colombia, and will bring a lot of evidence, scientific evidence, of course, but based on that, we are promoting very strong interventions that we know that they work. That's why we need parliamentarians, we need mayors, we need scientists, we need academia, we need the transport sector, we need people working on energy transition, we need people working on healthy urban planning, all of those urban planners that will be contributing to the fact that our cities will be reducing the air pollution and promoting better environment for our citizens. We count on all of you, on your support. Please be aware that science is there. We have more and more evidence every day, even how exposure to air pollution is affecting our brain. And I'm inviting you to keep your political courage, to keep pushing for something that is absolutely a very good cause, making sure that our citizens will have the right, the human right to breathe an air that will not kill them. Thank you very much.